Welcome to the Group Dentistry Now Show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
Welcome, everybody, to the Group Dentistry Now Show. I'm Bill Newman, and as always, we appreciate you listening in, whether it's Apple, Spotify, or Google, or maybe you're watching us on YouTube. But without a great audience like you, we wouldn't have great guests like the next two guests that we have on the show tonight. Now, we had Dr. Scott Sayer on a while back from the Vesper Institute, but we've actually got a couple of his faculty members on, and we're going to talk about the Vesper Institute and IV sedation. So we have two well-known oral surgeons. We have Dr. Jay Reznick, and we have Dr. John Roberson. How you both doing tonight?
Doing great. How are you?
Fine, Bill. We're doing great. How are you tonight?
Great. We appreciate you being on. We're actually recording this on a weekend, so it's really special for you to both come on. I know you're both busy and trying to get everybody's schedules lined up. So glad we have you now. Dr. Reznick, would you mind telling the audience that may not know you a little bit about your background?
Okay. I am an oral and maxillofacial surgeon. I've been practicing in Southern California, a suburb of Los Angeles called Tarzana, for about 25 years or so. I did my dental school at Tufts, medical school at University of Southern California, did general surgery at Huntington Memorial Hospital, and oral and maxillofacial surgery at LA County USC Medical Center. Seems like it was just yesterday, but it's actually longer ago than I like to admit. So I've been involved in the educational side of dentistry for probably about almost 25 years, I think. And so I lecturing on very different topics. And, a lot of what I do, I speak to oral surgeons and other specialists too, but a lot of what I do is I speak to general dentists. And my philosophy is that if you want to do an oral surgical procedure, I want to teach you to think like an oral surgeon and to be able to do what you do and do it to the best of your ability, and also know what your limits are and have a good way to make a smart clinical decision whether this is something you should do or someone else. About 15 years ago, I started an educational website called Online Oral Surgery, and we have, I think, about 40 plus hours of video. And what's interesting is it's not just PowerPoint slides. It's actually live video filmed in surgery, showing various cases and talking about them. And, what do we do to prepare for this? What are we going to look out for? If a complication happens, how do we manage this? And so it really gives you a complete understanding of what you do, because really, if you tell yourself, I think I can take out that tooth, you shouldn't do it. Only if you can say, I know that I can do it, should you pick up that first instrument. And so that's kind of been my philosophy of teaching for the last 25 years.
Thanks, Jay. Dr. Roberson, tell us a little bit about your background.
Absolutely. I'm John Roberson. I'm from Hattiesburg, Mississippi. I'm an oral and maxillofacial surgeon, just like Jay. I've started my 26th year now. I went to the University of Mississippi School of Dentistry. After that, I then went straight to the University of Cincinnati Medical Center oral and maxillofacial surgery program and spent 4 years there. Then I returned back home to Hattiesburg, and I am also involved on the educational side. I have been lecturing now nationally for about 25 years on medical emergencies, sedation emergencies, emergency drug kit, and medical emergency preparedness. And I'm all about the team concept. To the thousands of dentists as well as their staff members that I have lectured to. I'm all about getting you ready for that unthinkable event that could happen in your office. And you know, the thing about it, Bill, none of us have a crystal ball, and we don't know when that's going to happen. And this is why we've got to be prepared. So bottom line, just like Jay, I want to see every person that attends my lectures, I want them trained to the fullest. I want them to do their very best and be able to handle a crisis situation.
Thanks, John. So let's get into what you're going to be teaching what you are teaching GPs. So I guess one of the questions is, and Jay, you might have touched on this a little bit, but why are two oral surgeons teaching IV sedation dentistry to GPs?
Good question. No, I think it's really a smart way to put together a really high quality, comprehensive IV sedation course, because John and I are both in full-time private practice. We've both been practicing about 25 years, and every day we do multiple moderate sedations, deep sedations, general anesthetics. We are educators. We know how to convey information to students to get them to learn and understand what we're telling them. And in addition, we have other faculty members that we'll get into, but our goal, as John mentioned, is to kind of teach the highest level we possibly can. And I think, given our experience, we've both, like I said, both been practicing 25 years, and the training that we've had to get there. And one day I sat down and calculated how many hours of training we actually get after dental school to become oral surgeons, and it's numbers over 10,000 additional hours. So it's a lot. There probably isn't much that we haven't seen in our careers, either in residency or in private practice. And so we're coming in with a very kind of comprehensive level of knowledge and understanding, and we're able to relate what we're teaching to the dentists who are taking the course. And so we want to make sure that if you're going to do IV sedation, just like I mentioned, if you're going to do extractions or implants or whatever it may be, you need to do it at the highest level, the most competent level that you possibly can. And I think between John and I and Dr. Sayer and the other doctors on our faculty, I think we really accomplished that in our course.
John, do you have any more to add to that?
I do, Bill. I mean, I'd like to rephrase it. If I was a GP right now and I'm looking for an IV sedation course, who would I want to train me more than two dedicated, passionate oral and maxillofacial surgeons? As Jay said, this is sedation and anesthesia is all we did besides our dental alveolar stuff during our residency. We want to convey that knowledge to you to make you the very best you can possibly be. As you mentioned earlier about Dr. Sayer, Jay, myself, and Dr. Sayer, between the three of us, have around 150,000 IV sedations done in our career, or careers, that is, with no mishaps. We want to share our passion with you to make you the very best you can be.
So that leads me into really the next question is, how did you find out about Dr. Sayer and the Vesper Institute, and what made you become part of the faculty and decide to teach this IV sedation course?
Well, we have a sort of mutual colleague that Dr. Sayer and John and I both know, who connected us. This colleague knew that Dr. Sayer wanted to bring IV sedation into the Vesper Institute. It's something that he's been passionate about. He's been doing IV sedation dentistry for, I think, like 30 years. And so he was looking for, who are the best people to teach this? Who comes in with the most, the highest level of knowledge and experience? And this mutual colleague connected him with John and myself. And, we talked over the phone a couple times, did Zoom conferences, and eventually we both went to Cincinnati to visit the Vesper Institute and see what it's all about and see how Dr. Sayer's practice operates. And I got to tell you, we were both extremely impressed. We're very excited when we saw how he sets everything up, how everything that's done in his office is to, that high level of sophistication and patient safety. And it's exactly what we want to teach to our students. John and I have been talking about putting together an IV sedation course for dentists for as long as we've known each other, which is probably about 5 years or so. And when we were given this opportunity to meet Dr. Sayer and talk to him, it just, it all fell into place. And so we are really happy to be involved with Vesper Institute. There are, we can talk about later the other kinds of courses that are there, but it's a really special place to take continuing education. And we're so glad that we're part of it.
Anything you'd like to add, John?
Yes. Dr. Scott Sayer is a visionary. And his dream was to create the Vesper Institute and to make it the Midwest Center for Dental Education. He's done it. And as Jay said, the other aspect of that was missing was the IV Sedation Training Program. He wants to share with what he's been doing now for well over 35 years with other GPs that are interested or have thought about doing IV sedation. And then, as Jay said, he reached out to a mutual colleague. We were all introduced. We started working on the curriculum, thoroughly impressed with what he has done at the Vesper Institute. And then the dream became a reality. And Dr. Sayer has the goal of this being the very best IV sedation program a general dentist can pursue.
So let's talk a little bit about that. What makes this course different than other IV sedation courses out there?
Well, I think our diversity of faculty is one thing. The passion and experience of our faculty, and the fact that through our experience, we know what needs to be taught. Our goal is to teach general dentists to be extremely comfortable with IV sedation. It's part of their practice. Their staff are well-trained. They're there to help. They facilitate making the IV sedation go smoothly and safely. And we basically provide them kind of the whole soup to nuts package. We talk about, we start talking with very basics. We have about 60 hours of online didactic material, and then about 24 hours of in-person. And so it's a very comprehensive knowledge base that we're giving our dentists. But we also have a simulation lab that is like none other. And it's an incredible experience. The students spend an entire day in the sim lab before they go to actually the clinic. And the other thing is that we strongly encourage, and as John mentioned, we see this, anything you do in your office, whether it's implants or surgery or IV sedation, as a team effort. And so we strongly urge, we highly recommend, and we make it easy for dentists to bring their staff with them to learn alongside them, so that when they all return back to the office, they're all excited and they're all on the same page to start doing sedation dentistry. Not only that, but in the clinical portion, rather than going to a hospital and having a medical anesthesiologist kind of mentor you and you put in a couple IVs or 20 IVs, which is the minimum requirement, for something that's going to take 15 minutes, maybe 30 minutes at the most, we team up all of our students with doctors who are IV sedation certified at the Vesper Institute who are their one-on-one mentors. And these are general dentists who do IV sedation for general dentistry on a daily basis and teach our students what it's like to do IV sedation while you're doing general dentistry or extractions or whatever, implants, wherever it may be at the same time. And so I think that's very unique. I don't think too many other programs have something like that where it's sort of a one-on-one mentorship with someone who is at the same place, same kind of practice that you're in. And then to take things further, we want to make sure that they get their offices set up right. So we've actually put together with a company that we work with an entire IV sedation starter pack. And it has everything from anesthesia monitors, AED if you need one, all the IV sedation supplies, the catheters, the tubing, the pharmaceuticals, emergency equipment, airway equipment, everything you would possibly need to start doing IV sedation in your office. So you don't even have to think about, well, what am I going to buy? What do I have to get? I got to figure this out. We do all that for you. And then we have follow-up on top of that where we, on a monthly basis, we have a sort of a Zoom call where any doctor who's taken our course, who's been through the Vesper Institute, can join and ask us questions. Let us know, challenges they've had in their practice or just questions they had that we can answer and share with our colleagues, which is wonderful. And on top of that, and I'll be done in a second, if the doctors feel that after their 20 IV sedations, they're just not quite ready to start this in their office, to start doing IV sedation, they can come back to Vesper and they can do more IV sedation cases so that they're incredibly comfortable and ready to go when they get back to their offices. How's that?
Sounds pretty comprehensive, to say the least.
It is. John? We've put a lot of time and energy and thought into this. And again, it's my perspective, John's perspective, Dr. Sayer's perspective, medical anesthesiologists. We've all had input on how this course was put together. So I think it's a phenomenal experience.
John?
Yes, Bill. I just want to ditto everything that Jay just said. When we decided to do this course, we knew what it took to put this together, and hundreds of hours were dedicated to making this the best course for a GP. Now, when I say GP, I also want to point out periodontist or endodontist, other specialties besides oral surgeons that might want to also get IV sedation training. They can get that here. And I just love what we have developed, Bill, because it's basically 3 phases. As Jay said, phase 1 is your online. Phase 2 is the in-person didactic with Jay, myself, Dr. Sayer. And then we end our in-person with simulation day, as Jay said, which is an incredible experience for our students. And then they go into phase 3. They have the option, Bill, with phase 3, they can stay for clinicals and then mentor, as Jay said, one-on-one with a fellow general dentist. So they're with them all day. Or they may not go into clinicals, might need to go back to their practice. And then when they're ready for phase 3 or clinicals, they come back to Vesper and get 20 or more cases. And just to point out again what Jay said, we don't want our students to leave, or our graduates, I should say, to leave and not go back to their practice and not perform IV sedation. This is why you're doing this. We are going to get you ready. We are going to make you competent. We are going to make you confident about doing this. And when you get back, like Jay said, you know what? I think I might want to go back and see a few more cases. Absolutely. I don't know of another program out there, Bill, that would do that for their students. But very excited. about this. And the other beautiful thing about it, Bill, we're not in a hurry. We're not trying to say, hey, we're going to get it done in a week. We want you ready. We want you to feel very confident about all of this.
Well, that's great, for sure. I think that the flexibility that you offer really, with the in person in particular. Tell me a little bit more about online. What does that training look like?
John, why don't you take that? Because that's
Sure,
that was your
I'll
baby.
be glad to. So, our online is about 75 plus hours, Bill. We're covering everything. We'll have an introduction to medical emergencies and cover around 24 to 28 different medical and sedation emergencies. We're going to have mock drills developed for each one of those so you and your team know what to do. We're going to have an in-depth pharmacology session as well too. So we're covering a plethora of subjects, getting you ready before you arrive in Cincinnati for the in-person didactic portion of this. And we set this up, Bill, in a way that they start roughly about 6 to 8 weeks before, and there's specific modules they have to get done. Then they move on to the next set of modules. And then when they graduate from that, they are now ready for phase 2. But you've got to have phase 1 completely done before you can start phase 2, which is the in-person didactic portion.
So our audience is made up of DSOs. Some of them could be rather large, and some are doctor owners. Some are doctors that are working for the DSO, more like associate level. And then we have also emerging groups where most of those are doctor owned and led. They may have 3 to 15 locations, but they have multiple doctors. So what type of program do you have, and what's the flexibility look like for somebody that is multi-site, might want to send many of their doctors, several doctors there? How would that work?
Well, as John mentioned, we have a lot of flexibility built into our course. The online didactic, the 75 hours, can be done on the doctor's own time in the evening. They go through the modules in sequence, but they can always go back and review. And that way they make sure that they understand everything. It's not just watching a video and then you can't watch it again. And these are true interactive modules that have been put together that are just amazing. And then we have a number of different start times for our in-person didactic. And we're looking right now at the possibility of doing the in-person didactic at sites other than the Vesper Institute, because there is demand all over the country for a course of this kind of quality. And for a DSO, one possibility is that if we could actually do the live didactic portion at your facility or at your headquarters or wherever you would like it to be done. And then as far as the clinical goes, the phase 3 that John mentioned, that can be done however they want to do it. They can come when they're ready, do all 20 cases in sequence, or they can maybe go for a couple days, go back to the practice, come back another 2 weeks later and do a couple more days to get up to their 20 or more cases. And so there's a lot of flexibility in our program that will allow DSOs to be able to send a large number of their dentists to our programs. It's very kind of, hate to reuse the word flexible, but we can mold it in many ways to make it ideal for whatever group wants their doctors to take our course and become trained in IV sedation, because it's a huge benefit to their practices to be able to treat the 20 to 30% of patients in the U.S. who are afraid to go to the dentist because of past experiences, fear, anxiety, medical issues, et cetera. And it opens up a whole new world of potential patients to them.
So let's talk a little bit about what students can expect once they graduate. John, do you want to take that?
Oh, I'd love to. So, after you have finished clinicals, you will then go back to your practice, but you're never alone. You will always be part of the Vesper Nation, as we like to call it. As Jay alluded to earlier, the great thing about when you leave our program, you will be given a very thorough list of everything you need to introduce sedation into your practice, everything you need to order, basically a one-stop shop. You're ready to go. And then, like we said, after you get your 20 plus cases, once you get back, you may want to do some more cases. All you have to do is come back to Vesper. You get more cases there as well, too. But the nice thing about this is the once a month program we have with all of our graduates. As Jay's already talked about, we go over any situation or question they may have. And then as that continues to grow, we basically become this community that wants to share information with each other. So everybody's out there taking care of patients and helping patients. Because I use the word helping patients, Bill, because so many patients are afraid of being hurt, pain, or anxiety. And we take care of pain by way of local anesthesia. But how do we take care of anxiety? We take care of that by some form of sedation, by IV sedation. You're able to alleviate a patient's anxieties, their fears, their apprehensiveness. And now, not only do you have a practice builder, but also a revenue generator as well, too. So everybody wins here, Bill. You being the dentist as well as the patient.
And if I can just throw in addition to our monthly Zoom meeting, the doctors who graduate have John and my email addresses and Dr. Sayer, and they can reach out to us at any time. And so that's, of course, we don't want them sending us an email when they've got an emergency in their dental chair, but to ask us questions and pick our brains, we're always available. And I think that's something that sets us apart too. And something else I was going to say, but I kind of lost my train of thought. It'll come back to me.
But Bill, I like to point out this again. Okay, I hope as we're all going through this, the audience is going to see what a well thought out course this is. Because when you graduate, the door doesn't get closed, Bill. The door stays open for any of our graduates. I want everybody to think about how nice this is to go back once a month and meet with Jay, myself, the MD anesthesiologist, the dentist anesthesiologist, Dr. Sayer, and ask us questions about, okay, what about this? What about that? Bottom line, you're never alone from the Vesper Institute. That's the beautiful thing about this course. Like I said, hundreds of hours and dedication has been put in to developing this course and how we could tweak it to make it the best it can possibly be.
And we're always open to suggestions from our students too. We want to get feedback from them, and we always, we'll make changes if we all agree that, oh, yeah, that makes sense. That was a great comment. The other thing I was going to add is that one of the, IV sedation to a lot of dentists seems like this scary thing. Maybe they've taken an oral sedation course and they'll give, some oral benzodiazepine and nitrous oxide. The thing about that is that it's not as reliable and consistent as IV sedation. You can't titrate the medications into the patient's effect. You have to give them a dose and wait 30 minutes to see what it does for them. IV sedation, moderate IV sedation, is extremely safe if you do it the way that we teach you, and you understand how to deal with any emergency or situation that may come up so it doesn't devolve into something that is unfortunate. That IV sedation can be titrated. You give a little bit, see how the patient responds, and they respond within a minute. You can give a little bit more and see how they respond to get them just at that level where they're relaxed, comfortable. They're letting you do whatever you need to do for them. Their gag reflex is diminished. Their anxiety is gone. And that's really hard to do with oral sedation. So IV sedation is kind of the next step. It's the next level in making our patients comfortable. And as we've probably said a couple times, one of our number one goals, and it's, I always tell my staff and I always tell my patients when I'm doing any kind of sedation or general anesthesia, the number one priority in my office and in all the offices of the doctors that we teach is patient safety. That has to come first all the time. And it's critically important that you know how to monitor your patient, you keep them safe, and those are the things that we emphasize, because I think I mentioned or John mentioned, we've been there, done that in a lot of situations. We've had patients, become apneic after giving them their initial dose of sedation. We've had patients go syncopal. We've had patients with vomiting after we gave them the first medication because they didn't stick to the NPO. We've managed a lot of those situations, allergies. And so we bring our knowledge and our experience to the course like I think not many other people can.
Great points, Jay.
Jay, excuse me, Bill. Didn't you want, what was that stat that you said that many people after they take an IV sedation course don't go back and do start IV sedation in their office?
I think it was like 80% of doctors who take an IV sedation course never implement it in their office. And it has to do with a lot of things. One is their staff didn't train with them. So to come back and try to bring something new into the practice is very difficult. When I was teaching my implant courses, I made sure that the doctors brought their staff with them to get them engaged and excited. Doctors will go back to their office being very excited about this IV sedation course they just took, but their staff is afraid of doing that. They don't know anything about sedation. They don't know how to handle emergencies. They just know basic, BLS. They don't know how to set up the room for IV sedation, where to position the monitors. And the doctor doesn't know, what do I need to buy? What do I need to do this? And I think all those things contribute to the 80% of doctors who go through IV sedation do not follow through. And that is something that we want to avoid or we want to get end. We want 99% of the doctors who go through our IV sedation training course to go back to their offices and become IV sedation dentists.
So, Bill, to lead in after what Jay just said on that, because again, when we do our simulations, we're going to push you to the limit that day because we're all about safety. We're all about you going back to your office and you know what to do should an adverse situation occur in your office. We're going to cover it in depth and mention that like you did earlier, Bill, about the DSO. We have the variability as well as the adaptive situation to work with any DSO. Okay. As Jay said, the great thing about our program, phase 1, phase 2, phase 3. Phase 1, I don't care what DSO you are, where you are, your members, your dentists would take that online. Phase 2, your whole group can come to Cincinnati. We train you there, or Jay and I and Dr. Sarah come to you and train your group there. Then phase 3, you go to clinicals, and that's at Cincinnati. So for any DSO that is thinking about doing this for their dentists, because I know there's many dentists out there, I'd love to add this to my repertoire, but what program do I choose? Well, at Vesper Institute, we're waiting for you. We're ready to take you to the next level. We're ready to take your practice to a whole new level. Now, on the IV sedation training side, our faculty members, of course, our founder is Dr. Scott Sayre. The co-directors are Jay and myself. We have an MD anesthesiologist, Dr. Diane Breidenball, and we have a dentist anesthesia, Dr. Gene Franks. Then we've got 15 IV sedation certified general dentists. That's what makes this program just so exciting and so unique, because when you get to clinicals, you're one-on-one with a dentist that's doing the same thing you're doing back home in your practice day by day. So you get to spend 8 hours with one of our general dentists. The next day you're with a separate general dentist. You're getting to see everything, whether it be an implant, an extraction, a composite restoration, a crown, so any bone grafting. You get to see how it's done, so you can take this back to your practice and be the very best at what you do.
Yeah. And what I'd like to add is that, a lot of the courses that are out there, it's a 20, 30-minute case. But in real life, in a dental practice, if you're doing a number of root canals or you're doing a number of extractions or implants, the case may go 2 hours. And so the experience that our students have when they come in for the hands-on is they will do 30-minute cases, 10-minute cases, hour-long cases, 2-hour-long cases, and learn how to manage the sedation and the medications for what they're doing. Because they're totally different animals. The way that you would, the drugs that you would give a patient, the dosages are different depending on how long your procedure is going to be. And so that's another important thing to learn, because if you've just learned how to do sedation for short cases, that's all you're going to do in your practice. And we want you to be able to do everything you do as a general dentist using IV sedation to make your patients more comfortable and make it easier for you too.
So that really leads into the next question about 2024. What does the calendar look like for upcoming courses? And then the other question would be, how many students do you typically have in a class? I know you said you can customize for a DSO, so you can actually come and join them there. But of course, they have to get started with the online work initially. So what does the calendar look like in 2024?
We generally have 8 to 12 doctors per course, and that's just because of with the facilities and the simulations and the number of students who are doing the hands-on, and only so many. We have 15 GP sedation mentors, and of course, we have to have the patients. So if we had 30 doctors come to one course, of course to do their clinicals, we couldn't handle that all at once. The lecture course, we could actually handle any number because you're not going into the clinicals. And we've got courses for 2024 already scheduled for starting April 26th, June 21st, August 16th, October 18th, and December 6th. And when if they come to us for the in-person didactic, they have the option of going back to their practices or going right in the next day to the clinical. And they also have the option of doing that whenever they want and however they want to divide it up. So it gives them a lot of flexibility to work into their schedule. But we've got 5 didactic sessions, the 24-hour, three days of 8-hour lecture. We have that set up for 5 days so far in 2024. And if there's a greater demand, we'll add more courses. And as we said, we're looking to take that portion on the road also, so we can teach doctors who can't make it to Cincinnati, at least for the clinic or for the in-person didactic, we can kind of come to them. And so, we have at least 5 courses scheduled, but we probably by the end of 2024 will have done more than that.
So, Bill, I want to add on to that right now because we have an outside entity that has already approached us about the possibility of adding a course in May in Nashville and July in Philadelphia. Why? Because of our customization of our course, our flexibility, our adaptive aspect of phase 2. So that's the great thing about it. So we've already had some groups approach us. So we can work with anybody on this. Jay and I love to teach. Okay. It's a passion of ours. And you're going to feel that passion when you're at phase 2. Because, and that's the other thing we haven't even talked about. When you come to our course, you're going to see Jay and I all day, every day during phase 2. And to me, that really matters because we want to be as close as we can one-on-one with you as well, because it's our job to get you ready for clinicals, and you will be ready, no doubt, for sure.
Thanks, John. What we're going to do is we're going to drop some of those dates in the show notes so people will know when to expect things. But really, you can go to VesperInstitute.com. We'll make sure we drop that URL in the show notes as well. And you
Correct.
can stay
There's actually a separate, we are not listed, the IV sedation course is not listed with the other courses. It has its own drop down on the top menu for intravenous sedation or moderate sedation. So that's where they want to click to see all the dates and all the information about the course.
Okay, and we'll make sure that we drop that link in the show notes as well so people can go right to the IV sedation area and find out when things are going on. And if you're a DSO and for whatever reason the timing doesn't work out, or you want the team to come out to your facility or to do something customized, you can reach out to Vesper Institute. So I guess as we wrap things up here, final thoughts, and then John and Jay, how do people reach out to you if they might have some questions about, the course? Because there's a lot going on. It sounds incredibly comprehensive and customized, which is wonderful. So there more than likely might be a couple of questions.
Yeah, well, we both have email. That's the best way to get a hold of us. And my email address is Dr. Reznick. That's Reznick, not Resnik or any other variation. DrReznick at VesperInstitute.com. And John, your email address?
My email address is Dr. John Roberson at midtownofs.com. DrJohnRoberson at midtownofs.com.
That's great. And we'll make sure, again, that those email addresses are in the show notes. And VesperInstitute.com, the IV sedation information is in the notes too, so you can go right there and find out more. But I mean, my takeaways here is extremely comprehensive, much different than any other IV sedation course that I've ever heard of before. The goal is that you want everybody that attends to actually be able to go back to the practices and feel confident enough to do this, do the sedation in a safe manner. And it sounds like you're really doing some special things at Vesper Institute. Any final thoughts before we sign off here tonight?
Yeah, there are so many of you right now out there, and I want to thank you for listening to our talk today. So many of you want to take your practice to another level. So many of you want to take care of that patient that comes in that's highly anxious. You don't want that patient to go somewhere else. Learn IV sedation. Learn IV sedation the Vesper Institute way. You will not regret signing up for our course. We are passionate at what we do. We are dedicated to you, your staff, and your patients. If you're thinking about IV sedation, think no more. Go to Vesper Institute, sign up. Jay and I look forward to meeting you and teaching you and always being a part of your practice, because we're always a phone call or an email away. Thank you.
And I'd just like to add that IV sedation is a truly transformative ability to provide your patients. It will really transform your practice. We think about, Bill, you've interviewed Dr. Sayer in the past, and you know how his practice went from a small general dental practice to an incredibly well-tuned, extremely successful IV sedation dentistry practice. Being able to develop the skills, learn how to do IV sedation, and provide it for your patients will literally rock your world. It will transform your practice, and it'll transform your life. And John and I both look forward to seeing you in Cincinnati.
Dr. Jay Reznick and Dr. John Roberson, we appreciate you both being on from Vesper Institute. Really great conversation. And thanks everybody for listening in, or maybe you're watching us on YouTube. But again, thank you both for being here. Great information. I think we're going to get a lot of people really interested in what you're doing. Probably going to get some emails, and hopefully you're going to get a bunch of DSOs registered, and you're going to have more dentists than you can handle. So until next time.
We're ready for that. We're ready for that. We love doing this. So the more the merrier. We're ready.
We can tell there's passion here. So this is good stuff.
Yep. And John and I both have traveling espresso makers. we both bought, so we've got plenty of energy to go around, no matter where we are.
Thanks, everybody. Until next time, this is the Group Dentistry Now Show.
The Group Dentistry Now Show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today, and please tell your colleagues about us.